Microminerals, part 2, iodine. Page number is 251, chapter 13, page number 251 in your nutrition science textbook. So iodine is a trace element that is naturally present in some food. It is added to some types of salt in the form of fortification, iodine fortified salt, and it is also available as a dietary supplement only for those patients of thyroid issues or other deficiencies in which doctor or dietitian may have prescribed it to them in the form of dietary supplement. So totally, the body contains about 15 to 23 mg of iodine, 80% of which is majoritarily used. It is used by the thyroid gland. Muscles, your salivary gland, even ovaries in women, they also contain certain amount of iodine stored. Majority of the iodine, whatever you take in your diet, okay, most of it is lost in urine. Okay, the remaining part of it, majority stays back in your thyroid gland for the production of thyroid hormones, for the well functioning of thyroid gland. And muscles, salivary glands, and ovary can also contain very trace amount of iodine, not much. Function. The most important function of iodine in the body is the synthesis of thyroid hormones, triiodothyronine, T3, and tetraiodothyronine, that is T4. In simple terms, you just have to identify it as T3 and T4. These are the two main thyroid hormones. There are other two thyroid hormones also that are secreted by other glands. It is not secreted by the thyroid gland. Thyroid gland will usually secrete three hormones. One is triiodothyronine, that is T3, tetraiodothyronine, that is T4, and one more is the calcitonin. Okay. So these are the three main hormones secreted by thyroid gland. But thyroid related hormones, there are other two. One is thyrotrophin releasing hormone secreted by the hypothalamus, and we have thyroid stimulating hormone TSH secreted by your anti-pituitary. Okay, we will discuss that later. But thyroid, thyroid gland secretes these two hormones which are related to iodine. Okay, the function of the iodine is related to these two hormones. Iodine does not have any function related to calcitonin hormone secreted by the thyroid gland. Okay, so triiodothyronine and tetraiodothyronine. So these are the two main thyroid hormones. For the synthesis of these two hormones, iodine is required. Okay, which influences large number of metabolic functions within the body. Also, it is involved, these two hormones are also involved in the growth and development in various aspects. In different age groups, different forms of growth and development is related to these thyroid hormones. But for the majority of population, when it comes to your basic metabolism, thyroid hormones plays a very important part in this. Okay. So when from the exam point of view, whatever I am taking in this class, that is what it is important for you to study from the micromineral chapter. No need to go into much detail of it. Okay, what is this mineral? Okay, what is this mineral? What is the main function of these minerals within your body? How is it absorbed or metabolized? Which are the best sources? Okay, RD you can just brush up. No, you don't have to mug up the RDA at all. Which are the best sources? Toxicity will lead to what? Deficiency will lead to what? Okay, so these are the major aspects of any vitamins and minerals that you have to study thoroughly, which you have to remember thoroughly from the exam point of view. Okay, is it clear to all? Apart from these informations taken in the presentation, whatever you read in your textbook is just for your additional knowledge. They will be people for whom, because of thyroid cancer, if a thyroid part or part of the thyroid gland or the entire thyroidectomy, okay, that operation is called thyroidectomy, partial or complete thyroidectomy. Okay, that is the name of the surgery, in which if it is a cancerous cell found in thyroid gland, the gland is completely removed. In this case, again, the patient will be put on hormonal replacement therapy. Okay, whenever an entire gland of your body is removed, for example, oophorectomy. Oophorectomy is a procedure in which ovaries are removed. Okay, if you find any cancer cells in ovaries, ovaries are removed. Again, the woman who is suffering, who has undergone oophorectomy, she will also be put under hormonal replacement therapy. Okay, so HRT is present in various levels. So they will be put on, usually they will be put on hormonal replacement therapy. So coming to the sub-functions of thyroid hormones, increased brain cell proliferation. Uh, the number of brain cell increases. Okay, that is one way. Converts carotenoids into vitamin A, beta carotene, and everything that you get from plant-based sources. Inactive form of vitamin A, it has to be converted into active form of vitamin A. Only then it can be stored within your body. Synthesis of protein and absorption of carbohydrate, iodine is required. Synthesis of T3 and T4, we have seen that is the most important function of iodine. It regulates growth and development hormone, growth hormones as well. Stimulate metabolic rate by 30% because of its involvement in the synthesis of T3 and T4. That is how iodine helps in the metabolism. Normal development of brain cell proliferation has to take place when you grow up. Only then your EQ, IQ, cognitive development skills, motor development can happen based on your milestones, childhood milestones or adult milestones. Okay, essential for reproduction as well. Even though people who have issues with thyroid gland, hypothyroidism, hyperthyroidism, okay, various thyroid issues can also have certain infertility or libido related issues as well. Okay, people who suffer from thyroid issues, they also suffer from certain degree of fertility issues as well to conceive. So these are the other sub functions of thyroid, other sub functions of iodine. Coming to the absorption and metabolism, iodine that you take in diet, majority of it comes from your salt, fresh fruits and vegetables. Okay, and majority of the Indian way of cooking that you do, okay, like boiling, sauteing, deep frying, whatever Indian way of cooking we have, a lot of iodine is lost in that. Okay, specifically when you boil something, majority of the iodine in that food, if you're boiling it, 50 to 58% of it is lost. Okay, a small study they have done in if those who have the textbook, losses during cooking, a topic is given on page number 255. You can read that which type of cooking leads to how much percent of loss in iodine. Okay, so iodine in diet, it's whatever is left in the left back in the food, it is usually absorbed through your GI tract. Okay, it circulates in your plasma from your intestine. It will be absorbed directly, active transportation. It circulates in your blood plasma as an inorganic iodide in the blood. And from there, it goes to 5% of it will go to the thyroid gland for the major function, synthesis of T3 and T4. 90 to 95% of it is lost through the urine. Okay, just a very few amount of iodine is what you require in your diet, and that also out of what has been absorbed from your body, from your diet, only 5%, 5 or 6% of it will be utilized by your thyroid gland, muscles, or other soft tissues, little bit here and there, and then 90% of it is usually lost in urine. Kidneys will excrete it out. Okay, so that is the simple explanation of your absorption and metabolism of iodine. So when it comes to the role of how the T3 and T4 is generated in the body, okay, iodine, iodine enters your intestine, but when it goes into the blood plasma, it is in inactive iodide form. Okay, and this inactive iodide form, when it enters your thyroid gland, it undergoes oxidization, which means it will burn up and it will form into iodine. Okay, iodine in your diet goes into the system, is absorbed from your GI tract. When it is in the blood, it is not in the iodine form, it is an iodide form. Okay, But when it reaches the thyroid gland, it gets oxidized, means it gets burnt up, and it forms back into iodine. Okay, it forms back into its original state. So this iodine combines with various amino acids. Okay, amino acids are like building blocks of protein, like tyrosine and all, thyroglobin, globulin, tyrosine. Okay, these are the different amino acids. Along with these amino acids, it will form its combination. It will combine. It will react with these amino acids, and then the hypothalamus, as soon as it detects the fall in blood thyroxine level, automatically the hypothalamus will release this TRH hormone. Okay, hypothalamus is very active in detecting what is low in the blood, what is high in the blood. As soon as the hypothalamus is able to detect that the thyroxine levels in the blood has fallen down, it is going down, immediately hypothalamus will uh, release the TRH hormone. This is thyrotrophin releasing hormone. Okay, thyrotrophin releasing hormone. Sometimes it is also called thyroid releasing hormone. So thyrotrophin releasing hormone is the full form of TRH. Okay, so hypothalamus in your brain, that will release this hormone. This hormone will go and activate the anterior pituitary gland. Pituitary gland is divided into two parts, anterior and posterior. Anterior means the front part of the pituitary gland, which is closer to your eyes. Okay, posterior pituitary gland is the back part of the pituitary gland. Okay, so the TRH will go, tyrotrophin releasing hormone will go and activate the anterior pituitary gland, and from there TSH hormone is released. This is thyroid stimulating hormone. Okay, so TSH, this thyroid stimulating hormone, will go and stimulate the thyroid gland. From the name itself, you can understand what would be its function. Okay, so immediately always remember glands. Why are glands different from other secretory part of your body? We term specific parts in your body as a gland because whatever they are releasing, they are directly releasing into the bloodstream. Okay, that is why it is a part of the endocrine system. Whatever these organs or whatever these parts or these this speck of tissues, whatever they release, they produce and they release. If they release it directly into the bloodstream, blood carries it to the various parts of the body, and wherever it is required, activity starts. Okay, so that is how hormones function. Hormones are always released into your bloodstream. Okay, so pituitary gland will release the TSH hormone into the bloodstream. Blood arrives at the thyroid gland. From there, the thyroid stimulating hormone, automatically the stimulation starts, and T3 and T4 hormones will will be secreted from the thyroid gland. Okay, directly into the blood circulation. Again, this blood circulation will go to various part of the body wherever metabolism is required, and that's how your body's metabolism and other functions of T3 and T4 are carried out. Okay, so this is the physiology of how thyroid hormones are secreted within the body. Is it clear to all how T3 and T4 gets released into the body? Those who suffer from hypothyroidism, which means those who are not able to or release or produce enough amount of T3 or T4 hormones, it's usually either your hypothalamus is not secreting TRH hormone, or pituitary gland is not secreting TSH hormone. Otherwise, it may be the issue of the thyroid gland. There may be some inflammation going on in the thyroid gland. Okay, some cancer going on with the thyroid gland. If it is a cancer, usually it leads to hyperthyroidism because too many thyroid cells are produced. Okay, it leads to hyperthyroidism. So T3 and T4 will be released into the bloodstream. Okay, so if at all any of these hormones are reduced in their there is a reduction in the amount of secretion, it leads to hypothyroidism. If there is overproduction, it leads to hyperthyroidism. Okay, coming to the RDA. So RDA, we will discuss it in terms of microgram. Okay, not mg, it is microgram. So it is estimated that 50 to 1000 mg is what people require in various age groups. Okay, maximum is 1000 mg, not more than that. So proportionate amount is excreted in the urine as well. If at all certain days you have taken a little bit more of iodine based diet, okay, your kidneys can take care of it. As we have discussed few minutes back, 90 to 95% of iodine is excreted by your urine out of the body. Okay, so even if there is a little bit higher dosage of iodine in your diet, okay, for a day or two, your kidneys can handle it. Okay, if it continues for a pretty long time, over a period of time, you are still having high levels of iodine in the diet, that would lead to toxicity. As I mentioned, toxicity never develops within a day or two. It takes months and months to develop like for any toxicity to develop. So for adults, around 140 microgram per day is enough. Pregnant women, 220 micrograms per day. Lactating women, 280 micrograms per day. In children, 90. Okay. Even in when it comes to adolescent girls and boys, like as soon as they cross the age of 12. Okay, as soon as the teenagers cross the age of 12 or 13, their requirement is almost equal to adult requirement. Okay, 140 microgram per day it can be taken. Highest amount should be taken by lactating women, that is 280 microgram per day. You don't have to remember the RDA values by heart. It's just for your understanding. Okay, even if you can remember this range, 50 microgram to 1000 microgram should be taken in a regular diet, or that is the normal range. If you go beyond 1000 gram, that leads to toxicity over a period of time. And even if it is slightly higher, your diet is slightly higher in iodine, your kidneys, if you have a healthy functioning kidney, it can still take care of the toxins. Okay. Sources of iodine: seafoods, any types of fish or any seafood are great source of iodine. Eggs, dairy products, vegetables, iodized salts, iodine fortified food, not just salt, any food. Some oils are also fortified with iodine. Okay. Majority of the food that is a greatest source of iodine is usually your cereals. Any form of cereals, okay, are good source of iodine. Milk and milk products, all the dairy products are also the second best sources of iodine. Certain parts of India are known to be a goiter endemic area. For example, people who are ethnically, they belong to the Aravali hills of Rajasthan, Sub-Vindhya hills of Madhya Pradesh, Narmada Valley in Gujarat, hilly areas of Odisha. Usually, you notice this, people who live in the mountainous region, okay, of any part, every states of India, India has their own mountains, valleys, and some states have coastal areas. Okay, so all the mountain regions, for even the coastal states, okay, for example, the TS states of Karnataka, Kerala, Aurangabad, okay, Pune in Maharashtra, Koli Hills in Salem. So these are the hilly areas, okay, majority of the hilly areas, people who are the inhabitants of these mountainous regions and hilly areas, usually the Pahadi people, they are known to be the part of the endemic goiter belt of India. Okay, and endemic goiter belt means goiter is very common. Goiter is a very common nutritional deficiency based disorder seen in these regions. Okay, inhabitants of the coastal part of India, the peninsular region of India, the coastal part of India, they are relatively free of goiter. And iodine content of the food usually depends upon the iodine content of the soil. So any food or any cereal or any vegetable, fruits, whatever is grown at the near the coastal regions of the India, they are relatively better in iodine composition as compared to fruits, vegetables, or food grown in the hilly parts of the country. Okay, because the iodine composition in the soil matters. That is the main reason why it happens. People who are living near the coastal regions, they naturally, whatever vegetables and fruits are grown there, it is naturally slightly higher in iodine. They People who live in the coastal region, definitely fish or seafood becomes their staple diet. Okay, here religion, class does not matter much. If you are from a coastal part of the country, okay, fish or seafood is your staple diet. Okay, and seafood is a rich source of iodine as well, so there are less chances of goiter happening in these regions. Okay, but the sea people who live in the other parts of the India, like hilly regions, mountainous region, even if they have fish, they usually have access to freshwater fish, not the seawater fish. Okay, so the iodine content is different in freshwater fish as compared to seawater fish. Millet like jowar, that is sorghum, that has more iodine as compared to all the other plant food. Jowar, those who have jowar as their major staple for them. And in pulses, black gram and mustard seeds have the highest amount of iodine content as compared to other pulses. In animal products, obviously, dairy products are have the highest source of iodine. And fishes are the best sources of iodine. If you boil any food item, usually majority of the iodine is lost by boiling. Okay, frying, grilling, sauteing, you will not lose much iodine, but if you're boiling food, that leads to a loss of iodine. 58% of the iodine from that particular food is lost because of boiling. In pulses, black gram, urad dal. And in seeds, mustard seeds has the highest iodine content. And in millets, your jowar, sorghum. So iodine deficiency disorder, about 1.5 million population around the world are at the risk of IDD, that is iodine deficiency disorder, out of which 200 million are in India. Okay, so in developed countries, the problem is eliminated because they undergo strict implementation of food fortification as well, not just awareness and control, but food fortification in developed countries has played an important role in eradicating goiter from these regions. Okay, the prevalence of goiter among children is about 4%, and the proportion is highest in Maharashtra and in West Bengal, 9%. It could be some mistake they have done in the slide about the population. It should be around 1.5 billion population are at risk. Only then 200 million in India are at risk. Okay, in the first statement, 1.5 billion should be the correct word. Coming to the etiology means reasons. Okay, causative factors. Why does this happen? Those who are not from the healthcare background, etiology means the causes of IDD, iodine deficiency disorder. First is your environmental factors and intrinsic factors. Environmental factors usually what part of the country you live in. Okay, what is the staple food? Do you have access to fortified food? Okay, in certain rural parts of India where even electricity is not reaching, for them to have access to fortified salts and all is also very difficult. Okay, so definitely they remain in the IDD category, risk for IDD category. So wherever the soil content of iodine is naturally low, okay, people who come from that environment are deficient in iodine. And usually it happens in elevated regions because what happens in mountainous regions is that whenever heavy rainfalls occurs, okay, we know how soil erosion takes place over time. Okay, from higher plains, when the water is rushing down to the lower plains, it will take away majority of the minerals. It will wash away majority of the minerals of the soil along with that. Okay, that is the reason why people who live in higher plains or hilly regions, okay, they suffer from various micromineral deficiencies. Okay, because the rainwater on an annual basis is taking away, is washing off their soil out of microminerals. Okay, certain Kisan Ayojana programs is done in which when you can improve the soil quality by adding certain mineral powders into it. Okay, these kind of techniques are also followed usually after the monsoons. Okay, usually after the monsoons, for the next harvest season, this is called. And also the landslide prone areas of India, the mountain regions or higher regions which are prone to a lot of landslides on a yearly basis. Okay, there also iodine deficiency is seen. So that comes under the environmental factors. When it comes to intrinsic factors, hormonal synthesis, some congenital defects, depending on what kind of genes you have inherited through your family. Okay, the kind of goitrogens that are present in your diet. For example, there are different classes of goitrogen. Okay, majority of which is found in majority of these goitrogens. Goitrogens means goiter causing agents. Okay, goiter causing agents. Am I audible to all? Yeah. So goitrogens are substances that inhibit the iodine metabolism. Okay, it does not allow iodine to be absorbed by by your thyroid gland, or even if it is absorbed, it will inhibit the reaction of iodine with other amino acids to form T3 and T4. So that is goitrogen. So they either reduce the uptake of iodine, or they reduce the oxidation of iodine within the thyroid gland. So they have their own way of like minimizing the effect of iodine within the body. So there are different classes of goitrogen: class 1, class 2, class 3. You don't have to remember these names of goitrogens. You just have to understand what a goitrogen is. Okay, goitrogen are substances that interfere with iodine metabolism. Okay, so goitrogens are usually present in all the cruciferous vegetables like cauliflower, uh, broccoli, okay, and all the like certain green leafy vegetables are also high in crucifer, this goitrogen, like turnips. Okay, so some examples they have given in the textbook, which is usually used in Indian cooking: tapioca, finger millets like finger millet is ragi. Certain goitrogen are present in sorghum as well, which is a highest contributor of iodine, but it also has certain amount of goitrogen present. Okra is lady's finger, bhindi, sweet potato, almond, peaches, soya beans, bamboo shoots, lima beans, cassava is tapioca. Okay, cassava is tapioca. The another name for tapioca is cassava. Usually in India we use the name tapioca, but it's also called as cassava. Cabbage, cauliflower, okay, all the vegetables who belong to this brassicaceae family, that is broccoli and all, okay, broccoli, Brussels sprouts, okay, they all come under this particular family, so they are also rich in goitrogens. Groundnuts also to a certain degree have goitrogen, so they all have, like these all food that we have discussed, it is used throughout India, not they are not uh, like very concentrated in one part or one region of India. This is the reason why no state or union territory is free of iodine deficiency. Okay, in some or the other ways, all the states and union territory based on their staple diet. Okay, no, I'm not talking about sprouts. I was talking about Brussels sprouts. Brussels sprouts is a kind of vegetable. Okay, it also comes under the cruciferous family. Okay. Is my screen visible? Okay. Intrinsic factors are within your body. Environmental factors are factors outside your body, outside your physical body, which leads to iodine deficiency. Usually, the uh, lack of iodine access. Okay. So that leads to iodine deficiency. Intrinsic factors are your own congenital defects or problems, disease conditions you are born with or you're suffering from. Okay. If you're suffering from any malabsorption disorder, or when you were conceived, the pregnant mother was deficient in iodine, so the child is also deficient in iodine. So these all are intrinsic factors, okay, based on factors within your body that leads to iodine deficiency. Okay, for example, cancer, tumor, thyroid cancers, these are intrinsic factors, changes that has taken place within your body that leads to iodine deficiency. Okay. So iodine deficiency, it affects people who are in different age groups. It affects people differently. Uh, Stillbirth can take place if the pregnant mother, okay, if she is deficient in iodine, that would lead to stillbirth. Fetuses who are like very low birth weight and they are deficient in iodine, that could also lead to the death of the child soon after birth. So that is stillbirth. Low amount of T3 and T4 hormones in the fetuses. That could also lead to stillbirth, abortions, any congenital anomalies, any like increased infant mortality after birth. After birth, within 1 year of age, the child passes away. That is infant mortality. Okay. Neurological cretinism. Cretinism we will discuss. We'll see. I'll show you some signs and symptoms of it. Myxoedematous cretinism, that is a critical one in which ICU care is required. Psychomotor defects, neonatal goiter, that is goiter that happens in children who are less than 1 month old. Hypothyroidism in neonates. Usually, if the mother is on certain iodine inhibiting medications, okay, iodine inhibiting medications, that could also lead to neonatal hypothyroidism. Okay. Cretinism is iodine deficiency. It is usually seen in children. In adults, goiter can take place, hypothyroidism, certain psychomotor defects, in the long term. Goiter is a non-neoplastic condition in which non-neoplastic means it is not cancerous. Definitely there is a lump, okay, there is a swelling, enlargement of thyroid gland is there, lump on the throat is present, but it is not cancerous. Goiter is not cancerous. That is the reason why they have used the term non-neoplastic. It is not cancerous. It is non-toxic enlargement of thyroid gland. So this enlargement takes place to compensate for more iodine absorption and thyroid hormone production. To make more thyroid hormone, this enlargement of the thyroid gland has taken place. And usually it is a very painless condition, but if it is left like that, if it is not corrected on time, it can lead to pressure on your windpipe, trachea, okay, and it could lead to difficulty in breathing, difficulty in swallowing, okay. So immediate care has to be given, immediate treatment has to be given to goiter. Just give me a moment. Am I audible now? So that's about goiter. It is more common among adolescents and young girls. In children, usually they suffer from cretinism when it comes to iodine deficiency, and when it comes to the incidence rate of goiter, is more common amongst females than males. Women are more affected with goiter as compared to males. Psychomotor defects in adults as well as in children. That is your reduced IQ scores, impaired, you don't perform well in school, children don't perform well in school, okay, and their motor coordination, okay, leg, hand, feet, hand, eyes coordination is also affected. So these are the psychomotor defects seen in kids. Certain children may have impaired mental functions as well. Thyroid test is used to determine the levels of T3, T4, and TSH. You can do a thyroid panel test. Thyroid panel tests are done to determine the levels of T3, T4, and TSH. So goiter is non-neoplastic, as I mentioned. It is non-cancerous, non-inflammatory, and non-toxic enlargement of thyroid gland. It is usually why this enlargement happens, because the body knows, the thyroid gland knows that it is not making enough amount of T3 and T4 hormones. Okay, so it tries to compensate by hyperplasia. Hyperplasia means more cell divisions take place, okay, and it becomes larger and larger in size. It is trying to make more T3 and T4, okay. So it is a compensatory reaction of your thyroid gland. That is what goiter is, okay. So deficiency of thyroid and excessive TSH leads to the increased number of size and number in thyroid cells. So thyroid cells will increase in its number. That also leads to enlargement, and the size of the thyroid cells is also larger than normal. Okay, so that is the reason why this big lump happens to appear on the throat, which is not, it is usually painless. It does not lead to any pain. It is non-inflammatory. Okay, and it is non-toxic. It is not cancerous. But if it keeps on increasing in size, it will lead to obstruction in your airway, in your food pipe. Okay, swallowing difficulty, breathing difficulty. If it keeps increasing, if it is not treated well, these are the complications that can arise. So you can see here the difference between a normal thyroid gland and a goiter affected thyroid gland. So incidence, the prevalence of goiter is more among children and adolescents and young adults. It's not seen more in older people, and females are more affected than males. Coming to cretinism, congenital iodine deficiency syndrome is known as cretinism. Some children who are born with iodine deficiency, either that their mother was not having enough amount of iodine-based diet during pregnancy, and it is by birth they have certain signs and symptoms that shows cretinism, and they have impaired physical and mental development as they age on. And due to this insufficient production of thyroid hormone is one of the reasons. So they for entire life they stay hypothyroid, like they suffer from hypothyroidism, and usually it is caused during because of low dietary iodine in pregnancy. So pregnant women, if they're not considerate about their iodine intake, it could lead to a child who suffers from cretinism. Okay, so certain symptoms of cretinism has been shown in the picture. You can see here dry hair, coarse hair, lateral eyebrows, and it is very thin. Periorbital edema, that is swelling around the eyes, puffy, dull face and skin. So causes either lack of thyroid gland, which failed to mature during the pregnancy, failure of thyroid gland to produce thyroid hormone. This is congenital iodine deficiency syndrome, and certain medications, if the mother was taking or if the mother was undergoing any chemotherapy, radiotherapy for reducing the size of thyroid gland, that could affect the fetus as well. Iodine deficiency in the diet, this is endemic cretinism. So we have neurological cretinism and microedematous cretinism. So neurological cretinism, it leads to mental retardation. The children does not keep up in terms of their mental IQ. Their IQ and EQ is not as per their peers. They may be deaf or mute. They may have squint eyes, spastic diplegia, which is speaking difficulties, rigidity that affects their lower limbs. Their lower limbs and hands, it stay contracted. It does not stay relaxed. And because of non-relaxed limbs, when they try to walk, there is some difficulty in their gait. Gait means balance. The way how you balance your body while you walk, that is called gait. So there is some imbalance. It seems like they may fall or they're limping around. Okay. Brain development during the second trimester of pregnancy is also affected because of iodine deficiency. So that this is also a very critical time, specifically during the second trimester of pregnancy, 4th month, 5th month, 6th month of pregnancy. It's a very important time when you have to address your iodine deficiency. So myxoedematous cretinism, again, dry skin, coarse skin, swollen tongue, deep hoarse voice. In the behavior, they have an apathy kind of behavior. They don't care about anything. Okay, they do not have any attachment to anyone or anything. That is a apathy and mental deficiency. Even their height, skeletal growth, height will also be quite less as compared to their peers. And they usually don't suffer from deaf or being deaf or mute. So neurological cretinism, we have discussed right now all the conditions, signs and symptoms associated: retarded growth, deaf, mutism, motor spasticity, severe mental retardation with squint eyes. Squint eyes is very common. Myxoedematous cretinism, again, growth retardation is there. Incomplete maturation of facial expression, thickened and dry skin, small dry hair, eyelashes, eyebrow. It is very thin as well, which we have seen in cretinism. Thin eyebrows, it is seen in myxoedematous cretinism as well. Mental retardation, but comparatively, the intensity of mental retardation is quite less as compared to neurological. The children who suffer from neurological cretinism, their mental retardation level is much higher. Delayed sexual maturation and other whatever clinical manifestations you will find in hypothyroidism, same you will find here as well, because thyroid hormones are not produced enough. Hypothyroidism, a detailed lecture on this we have took in the diseases class. I hope majority of you have attended the class and seen the lecture. It is very important to understand, because in textbook, a separate chapter on hypothyroidism or thyroid issues they have not given, apart from this topic which we are discussing in about iodine. So please check the hypothyroidism class, which have been uploaded on the diseases class playlist. So you will get an in-depth view of how nutrition, or how is there any association of nutrition and hypothyroidism, in the preventive part, in the curative part, or the management part, what nutrition can play to bring down or to combat hyperthyroidism. Okay, all these in detail we have discussed there. So please check that video out. Okay. So hypothyroidism or underactive thyroid gland, it happens when thyroid gland does not make enough thyroid hormones to meet the body's requirement. It's very common among adults, okay, specifically among women. Women suffer hypothyroidism more as compared to men. And there are a lot of signs and symptoms associated with thyroidism. So we'll just go through some of it: coarse, dry skin, husky voice, delayed tendon reflexes, low serum T4 and T3 levels, and elevated TSH level. Okay, thyroid stimulating hormones are high, but the thyroid is not producing enough T3 and T4. Okay, so this is the laboratory diagnosis related to hypothyroidism. TSH, thyroid stimulating hormone levels are high, but T3 and T4 are still low. In hypothyroidism, you gain weight, but you will hardly gain 5 to 6 kg because of hypothyroidism. Anything more than 5 to 6 kg you are gaining because of hypothyroidism. It is not because of hypothyroidism. It is because of lifestyle. Okay. Not more than 6 kg you will gain because of thyroid issues. If you have, like for example, a person has gained weight around 15 kg or 20 kg, okay, suddenly over a span of few months, you cannot attribute that to thyroid issues. A majority of it, thyroid issues may be present. You must have diagnosed them. They have thyroid issues. It could be present. Okay, 30% could be the reason because of thyroid issues, but 70% of that weight gain was because of lifestyle. Okay. Yeah, overeating is seen in hypothyroidism. It's not just overeating. Even if you slightly increase your calories, your metabolism is quite low. Okay, your body metabolism is quite low. So even if you're eating something that you can consider, or a general person consider it as normal, but for you it will have a negative effect. 1 minute. So psychomotor defects, usually it is associated with your poor IQ score, poor motor coordination. lower than normal IQ scores. Motor coordination, you can check like if the child is able to catch a ball which you throw at them. Okay, so there are certain motor coordination tests that neurologists can do. If you take them to a neurologist, they do certain motor coordination test. So with that, it is understood if the child has a psychomotor defect or not. Yeah, if in rare cases people are still staying lean because they have a lifestyle that supports them to prevent putting on weight. Okay, or the calorie count on a daily basis could be quite low. That could also lead to leanness, or they are having they are aware of the diet that they have. Okay. Excessive weight gain cannot be attributed to hypothyroidism. That is what studies have shown. Excessive weight gain is associated with hypothyroidism, but excessive weight gain, for example, you were having a healthy BMI, but then within a year you became obese. That is not because of hypothyroidism. Okay. Thyroid hormone and weight gain relation is there, but only to a certain limit. As I mentioned, you gain more than 5 kg, 6 kg. Okay. Approximately 6 kg weight gain took place because of thyroid issues. Okay. That is quite normal. That association is justified. Okay. But you have gained 15 kg, 20 kg, and all that excessive weight gain, which completely alters your BMI. That is not because of hypothyroidism. That is majority because of your lifestyle choices. Impaired mental function, reduced mental function, low intelligence levels, apathy, lack of initiative, decision-making capacity that we have discussed in cretinism. In the myxoedematous cretinism, these are the signs and symptoms. Coming to the prevention strategy, we have the National Iodine Control Program, Iodine Deficiency Disease Disorders Control Program in India. Iodine fortification is also a part of this program. So in the year 1960, National Goiter Control Program was started, but now it's not just goiter control, because goiter is not the only disease condition that happens because of iodine deficiency. It's a spectrum we have discussed just now. It is a spectrum, still from stillbirth, okay, to cretinism. Iodine deficiency leads to a spectrum of diseases. So the name has been changed for this program. It was earlier National Goiter Control Program, but now it is National Iodine Deficiency Disorder Control Program. Since April 1992, the program was implemented at the Department of Health in Government of India. So some salient features of this program is supply of iodized salt instead of common salt. Okay, do regular surveys, endemic level surveys, epidemiological studies and all is done on a regular basis to keep a check on goiter cases. Is it rising? Is it still rising? Or have we decreased it over these years? Resurvey after every 5 years of the same goiter cases on the same regions. Okay, every 5 years, how many more goiter cases this particular locality or town has reported. Okay. Laboratory monitoring, health education, publicity through media, radio, television, and other forms of media. Health education is provided to the general public. And a lot of goiter control cells is established in all your states and union territories of India, making sure that specifically in the goiter endemic areas, few regions which we have discussed earlier, usually all the hill stations and mountainous and hill and valley regions of India. Okay. Why valley regions? Valley regions face a lot of landslides. Okay, valley is a region which is a place which is sandwiched in between two hills or mountains. They face a lot of floods, rainfall, and landslides on a yearly basis. So valleys are also completely depleted of iodine from the soil. Okay, so specifically in these regions, these goiter belt, what we call in India, for in these regions, iodized salt is compulsorily sold. So major components of the National Iodine Deficiency Control Program is iodine fortification. So this is only the only way to combat iodine deficiency at a national level. One single program to combat iodine deficiency at a national level is through iodine fortification. So not just a salt, but even your atta, wheat flour, bread, milk, sugar, drinking water, okay, and common salt. These all food can be fortified with iodine. And it is a practice in different parts of the world. In India, iodized salt is the most common one. It is the most famous one. So whatever this principles of fortification which we are discussing right now, it holds true for all the other vitamins and minerals as well, not just for iodine. Okay. So whatever food you are deciding you want to fortify this particular food, okay, you should be very sure that this particular type of food is used by majority of the population. Okay, it is used in high quantity by majority of the population. For example, wheat and rice. In India, wheat and rice is a cereal that is used by majority of the population. Then comes millets, ragi, jowar, bajra. Okay, all these things come secondary. The first thing is wheat and rice is what we base our major Indian diet on. So iodine fortification of these pulses. Okay, these cereals. Milk is used by every states and union territory. So milk can be fortified, and bread, sugar is used by everyone. Every household uses sugar. That can be fortified. So this drinking water. Okay, so these kind of decisions you have to take. Which food component is used by the entire population in high volume, that is the best one to be fortified. And it should be something that can be brought by everyone. People who are from a low socioeconomic background to upper middle class family, upper class family, everyone uses the same food component. Okay, so that kind of food you have to use, which is used by everyone. Okay, and which leads to less chance of toxicity. Nobody has got any rice toxicity, wheat related toxicity. Okay. Manpower and training, monitoring and surveillance, we have discussed. Every state and union territory has their own cells. Goiter control cells are present, or iodine deficiency disorder control cells are present. They do their regular monitoring and surveillance. Surveillance is done every 5 years to keep the track, to update the records. Manpower training is trying to impart skill to ASHA workers, healthcare workers, community health nurses, health doctors, okay, multiple purpose health workers. Okay, for all these people are given training from the government to identify cases of goiter, what kind of education you have to give, where you have to refer them. People who have been suffering from goiter, where should you refer them for further medical treatment? Okay, so that comes under the manpower training. Just a basic aspect of manpower training I'm stating here. When you go into the program in detail, you will find that these things in detail, but you don't require that. Mass communication, use of your radio networks, telecommunications, okay, advertisements. So these mass communication networks are used to impart health education to the entire population. And iodine fortification, you have iodized salt. And apart from that, you also have double fortified salt. So, for example, salt which is fortified with iodine as well as iron. Okay, that is double fortified salt. Iodine deficiency disorder can be tackled, and anemia also can be tackled. So that is the difference between iodized salt and double fortified salt. Again, this is low cost and it's a sustainable solution for a long term. And salt is not just fortified with iodine and iron, vitamin A, B12, zinc, folic acid. Okay, these all can be fortified into the salt as well. Water also can be fortified, usually the mineral water, uh, which you can buy, or the municipal level waters which are provided. Okay, not the bore wells that you have, not the bore wells. If you have private bore wells, fortification usually does not work there. But if you are getting water from the municipal supply, okay, you can expect to have a fortified water there. So, even fluorine for fortified water in certain areas. Use iodized salt. Okay, go for the iodized salt or double fortified salt. Look at your own health. Look at what region you live in. Is it a coastal region, hilly region? Okay, what kind of food you consume on a regular basis, and then you can make a sound choice of it. Okay. Pink salt, we do not have any evidence-based researches done which proves the benefit aspects of pink salt. Okay, it's whatever benefits you see about pink salt, it's still a myth. We can still consider it as a myth because we do not have enough evidence supporting all the claims that pink salt has. Okay, but iodine fortified salt, double fortified salt, it is evidence based. If it is if a national level if at a national level a government of a country is organizing these programs, means it is completely evidence based. It is scientific, it is evidence based, it's proven. Other countries, other developed countries have done this. They have succeeded in eliminating endemic goiters. Okay, that's why we are following the same suit. So we have a strong evidence of fortified salts. Other salts like pink salt, senta namak and all, we do not have enough clinical evidence that supports the use of it. Somewhere here and there, just for flavoring purposes, you can use it, like black salt and all. It is specifically used for its sulfur quantity. Black salt is good in sulfur quantity. Sulfur. That's the reason why it has a very pungent smell and taste. Okay, so for flavoring purpose, you can add these salt. Definitely, you can do that. But for its nutritional value, it's not recommended. There are other sources of iodine as well. People who have high BP, they can eat more fish. If you're a non-vegetarian, you can eat more fish. Other sources of iodine which we have discussed, and even seaweed. If you're a vegetarian, you can try to search more for seaweed. Okay, check your blood iodide levels. If it is below normal, you can ask your doctor to give you a supplement. Okay, vegetarian sources which is from sea is seaweed. Seaweed is kind of a vanaspati that is found in the ocean. Yeah, seaweed. That is a good source of iodine in vegetarians. Or any fruits and vegetables grown in the coastal part. If you are living in the coastal part, your soil quantity is better than the ones who live in the hilly regions. Iodized oil is also available for oral as well as intramuscular injections. And right now, France is the only country which produces this oil, iodized oil, on a commercial scale from poppy seed oil. And it is seen that if you just inject 1 ml of iodized oil, you give an injection, okay, 1 ml of iodized oil injection, if it is given, which has around 480 mg of iodine, it can maintain iodine supply for the next 2 to 3 years. For the next 2 to 3 years, your iodine supply for the body can be maintained. That is what they have claimed. And if you are taking the oral dose of 1 ml of this iodine fortified oil, it can protect you for 1 year from iodine deficiency. So France is the only country which is following this right now. It is not yet developed in India as well. Iodized water, iodine can be added directly into the drinking water. Iodine does not have a taste or smell, so it will not change the quantity or quality of water in terms of taste or smell. So drinking water can be iodized as well. Public water supply, or as I mentioned, in municipal water supply, iodization can be achieved. But when it comes to borewell and all, it is not, it's not feasible. If you're getting your water supply from a public facility or from a municipal facility, you can expect to have iodized water. If if your local government has permitted it, okay, you have to check that. Excess intake of iodine, maximum you can take 1,000 microgram per day. That is what ICMR has recommended. If you are taking more than that, you are susceptible to uh, toxicity, iodine toxicity, and usually it can lead to hyperthyroidism, thyroiditis, Hashimoto's thyroiditis, uh, carcinomas in severe cases. I don't think so. RO water has iodine. I'm not aware of it. RO water has iodine. But if you are using iodized salt, you don't have to worry about water fortification. Use double fortified salt. You don't have to worry about fortification.